Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. I am really excited about today's episode. We're going to talk about vaccines, the updates, the constant changing of things, and what you need to know to feel informed and prepared, especially when you go visit your pediatrician. So for that, we have Dr. Joel Warsh. I'm going to hand it over to you if you could tell us about yourself and what you do.
I'm a pediatrician in Los Angeles, California. Practice integrative medicine, so I try to balance the best of both worlds, modern medicine and integrative practices. I've done all the regular training. I totally believe in modern medicine, but I just feel like there is a time and a place, and we're all too quick sometimes these days to rush to a medication when there are all sorts of other natural remedies that are used all over the world. For me, I trained at Children's Hospital Los Angeles, great Western program, but during my training, met my wife. She's very holistic minded, and it kind of opened up my eyes to a little bit of a different world. And so I've been practicing in integrative medicine for over the last decade and trying to balancing both worlds.
I love that balance. I feel like that's a lot of moms trying to understand like what's the best way to go about all of this stuff right now. So with that, we've had some recent changes with the whole vaccine recommendations. Would you be able to tell us a little bit about the recent updates on those childhood recommendations for the vaccine schedule, and why were these changes made to begin with?
Sure. I mean, I don't know if we have enough time with all this stuff going on, to take 3 hours. I mean, it seems like every day something's changing. And yeah, I can certainly get in some of that. I guess maybe even before we get into that, just to kind of go back a little bit for me. So, I'm not against vaccines in any way. We do vaccines in my practice. I personally believe in informed consent. I don't believe in forcing people to do anything. We have lots of patients in our office that do the regular vaccine schedule. Some people go on a slower schedule. Some people don't do it. I believe in education, having discussions like these. And I feel like it's very unfortunate that over the last few years, especially, the word vaccine has been so controversial and so censored, and we haven't been able to have conversations. And that's one of the main reasons why I even wrote a book in the first place, which is called Between a Shot and a Hard Place. I wanted these discussions to happen. And I think, thankfully, at least, we're able to have these conversations now a little bit more. There's a lot more discussion going on for good and bad. And unfortunately, I think it's very confusing for parents right now. There's so much back and forth. There's so many changes that are happening very quickly. And I think it's really frustrating for parents. I think it's a more important time than ever that we are able to talk about it. And I'm not trying to convince anybody to do or not do anything. That's the way that I write the book. I want to have a balanced approach. I want to have discussions. And, again, it's like sometimes people say, oh, anti-vaccine, this and that. It doesn't even make any sense. I'm not against vaccines. I think it's just we need to be able to have discussions and talk about what we do and do not know. And to your point, yeah, there have been a lot of changes recently. I would say the biggest ones would be change of hepatitis B at birth. So it used to be recommended for all babies, and now the new CDC recommendation is only for high-risk infants, which is the way that it used to be many, many years ago. And some countries follow that. Other countries do recommend it for newborns, but that's something that's changed. And then also the CDC schedule has been updated pretty drastically in the last, just recently, just last few weeks. The American Academy of Pediatrics and other associations haven't necessarily agreed with some of those changes, but at least in terms of the CDC, they moved some of the vaccines to shared clinical decision making. So not necessarily on the regular recommended schedule for everybody, but more of a discuss with your doctor if you feel like you're high risk or you want to do those. So that would include RSV, flu, hepatitis A, hepatitis B, and rotavirus. So they're all still available. They're all still recommended by the American Academy of Pediatrics, but they're not necessarily strongly recommended for every child from the CDC. But obviously that's, quite controversial and very much evolving.
Yeah. A side note, I do have an episode that talks about the 3 different vaccines or medications that are offered when a child is born at the hospital. So I go over those. With that said, so you had mentioned all of the different new recommendations. How do the new vaccine recommendations impact parents and pediatrician care routines? So if, I'm going into the doctor to see my pediatrician, how is that going to be different now?
Kind of, I think, depends on where you go. there's a lot of pushback on it. So I think for many doctors, they haven't really changed much at the moment. I mean, I think everyone's aware of some of these newer recommendations, but a lot of practices are still following the American Academy of Pediatrics, while other doctors might be more inclined to have discussions. And I think having discussions is good. I think we actually need that. I think there's been far too strong a push of a discussion, especially over the last few years, about only efficacy of vaccines and not about risks or safety from vaccines. And I think both things are important and needed. And I also think that we have seen the outcome of what happens when there's coercion and forcing people to do things and pushing people to do things that they don't necessarily want to do during COVID. And there's a lot of pushback now. I mean, one of the big, I think, outcomes of all that pushback is you see Secretary Kennedy in power at the HHS. You see the trust in medicine and public health is really gone. I mean, it used to be 70, 80% of people trusted public health and doctors, and now it's like 40%. You saw COVID vaccine recommendations even just a year ago that were recommended by the CDC, but almost nobody was doing it. Like 10, 20% of people were doing it. So that's a really not a great place to be. And I hope that in the long run, we can find some balance and find a little bit more mutual ground moving forward. Because I think everybody is on the same team. I mean, I think everybody wants healthy kids. Not everyone necessarily agrees on how to get there. Not everyone necessarily agrees on every single topic with vaccines. But ultimately, we want to protect kids. We want to minimize disease. We don't want any kid to die of measles or disease, which we could protect them for. But we also don't want kids that have reactions from vaccines. So both things can be true. And I believe that we haven't had enough conversation about vaccine safety over the last decade. And so we do need a little more of that. But at the same time, we don't want to also forget about the diseases. So some balance, I think, is good. And having discussions on these topics are good in general. But we have to kind of weigh out risks and benefits and try to find some from middle ground.
Such a valid point, just because now, yeah, you do see all of this information and you have people that are either pro vaccines or anti vaccines. And there really isn't like a lot of talk about like the reasoning why and the science behind certain vaccines. Or you hear people say, well, we got rid of polio. We don't need polio anymore. But it's still like you need to understand the why and the research and the science and not just somebody that has this idea or theory of why you should or shouldn't have a vaccine. So with all of that, now that a visit to a pediatrician is going to be slightly different, what should parents know or do differently as a result of these updates? So the vaccine schedule is going to be different for my current 8-month-old compared to my son that's almost 4 years old 4 years ago. Like, what should I do differently?
I think the most important thing right now for parents, because it is so confusing and frustrating, is I do think you need to get educated. I do think parents have to read a little bit and have to look at different sides of the conversation so that way they can at least understand what's going on. Even before I wrote my book, look, one of the things I was asked all the time is like, okay, what should I read? How do I know what to do? And I would always tell people, well, you really have to read multiple things, right? You can't just read one side, CDC side or someone who's, air quotes anti-vax to really get the full picture. I think it's really important to read a little bit on both areas. So you understand, what's the CDC perspective? What's the American Academy of Pediatrics perspective? Understand what the diseases are, how severe they are, what your risk is of actually getting those. And then if you are someone who's a little bit more conservative or has some concerns around vaccines or wants to go on a slower schedule, then you should also read some of the other concerns that people have brought up so you understand those conversations. So that way you can have at least an educated place to start. And that way you can have conversations with your doctor about any of your concerns. If you are someone who wants to do the regular schedule, then you can just follow the schedule. If you're somebody that wants to go slower, then I think it's important to understand risks versus benefits as much as we can. And that way you can ask your doctor educated questions. And you can also hopefully seek out a doctor who's willing to have those conversations. If you're with a practitioner that isn't willing to have those conversations, then that might not be the right doctor for you if you want to have those conversations. But you should feel comfortable doing any procedure on your child, any vaccine on your child. You should be able to ask questions if you have concerns. There should be nothing woo-woo or out there about that. Like you should be able to have informed consent and have discussions. And, we only know what we know, but we should at least be able to talk about those things. So I think it's important that parents shouldn't feel weird or out there. If they have a question, they should be able to talk about it. So that to me is really important. I mean, I think it's unfortunate that you do have to get some education. Like, I think it'd be nice if we could just say, oh, let's just trust the CDC, or let's just trust American Academy of Pediatrics, or let me just trust my doctor. But there are just so many voices right now, and they're so different. You get, HHS saying one thing, American Academy saying another thing. your doctor saying one thing, your friend's doctor saying a different thing, an influencer online saying one thing. And so you're like, I don't know what to do. I just want my kid to be healthy. So I do think you need to at least get some education, read something so you have an understanding of this topic if it's something that you are going to want to have a discussion about.
Hi everyone, it's your host Mariella. I wanted to thank you for listening and share some ways to show your continued support. You can rate and review on Apple Podcasts or Spotify. Share the show with friends and family. Buy me a coffee to help with the financial costs of running a podcast. Follow me on Instagram at newmomtalk.podcast. And finally, subscribe to my newsletter. Thank you for listening.
And now, I believe that on the West Coast, we kind of have stuck to the original recommendations for vaccines. Is that right? Like certain states have kind of decided to do like their own little pockets of what their recommendations are?
I mean, I wouldn't say that effectively anything has really changed at the moment. The CDC has updated their recommended schedule, but you were always allowed to do whatever you want. You're not required physically to do anything. Some states have school requirements, but the school requirements haven't really changed. They're all state by state. So it's really just what's recommended by the CDC versus what's recommended by the American Academy. And some states have kind of come out and said, oh, well, we're going to follow the American Academy pediatric schedule, which is what the CDC schedule was before. So ultimately, as a parent, while it's confusing because there are different schedules, not that much has really changed for most doctors. I would say most doctors are still following the schedule that was recommended before. And even still, everything should really be a shared decision, right? That should never been, that should just be everything. Like you should be talking about things. Here's what's recommended. Here's why I recommend it. And very little has changed for that. It's just that maybe for some of the vaccines, it's not as strong a recommendation anymore, at least from the CDC. And I don't know if doctors are going to take that up or not. Some will, some won't. But for you as a parent, not that much has changed.
Now, I know I didn't have this one in our questions, but would you be able to talk about like maybe a little bit about why they made those changes as far as say why they don't recommend a certain vaccine anymore? What's their reasoning?
Yeah, I read the policy statement that was put out. So the big reason that's noted is public trust. So the biggest concern overall is the fact that trust in public health has plummeted after COVID. The rates of vaccination are decreasing consistently over the last several years, and certainly a lot more now. The rate of exemptions and requests for exemptions has drastically increased, and the amount of unvaccinated kids is much higher than it ever used to be. So one of the things that HS did was they said, okay, well, let's look to other countries. Let's see what else other places are doing, and let's see if we can take some of the similar-ish schedule, similar-ish countries, and see if we could modify it to look like those countries. America did more vaccines really on the recommended schedule than anywhere else. And so they were modeling mostly against US and Canada and Japan and not US, against Europe and Canada and other countries, and was decided that we were going to model more like Denmark. Denmark recommends one of the lower amounts of vaccines that are out there. So I wouldn't say it's average. Denmark is really pretty low. It's like 10 vaccines I recommended versus 18 here. And they decided that given that there's still very high rates of uptake of vaccines in Denmark, and one of the big concerns was public trust, and they feel like if you choose the vaccines which you feel like are more important, then maybe that's going to increase trust and especially focus people to get their vaccines, the ones that are felt to be more important. So that was the general theory behind it, is really just about public trust and minimizing the amount of vaccines. Because at least in Denmark, I've heard some of their public health officials speak about it, and they feel like if you recommend too many vaccines, then people start to tune it out. They start to get concerned. So they'd rather focus on what they feel like are like the 10 most important ones, and then the other ones are just recommended, but not recommended as strongly. So that's the basis. You can agree or disagree with that, but that's why.
Interesting. I did listen to a whole podcast that talked about like the comparison with Denmark and the US and kind of why they recommend less. We have certain age groups or certain populations that maybe might need a little bit of extra attention. For those populations, what should they know? Yep.
The first point for this is we should be focused on individualized care in the doctor's office. Public health is about public health, meaning it's for the masses, but that's not necessarily what's right for your kid or what's more important for you. You know your kid best. and you and your doctor have that relationship. And so there are certain instances where a vaccine might be more important for you, or it might not be the right choice for you at that time. So these are things that are really important to discuss. I would say situations where you wouldn't want to get a vaccine, if you're actively sick, you don't want to deal with a vaccine in your immune system while you're in the middle of being really sick. So that's not a good time to do a vaccine. If you're allergic to something in a vaccine, so gelatin would be the most common allergy. So that maybe not the right thing for you. If you're allergic to a component of a vaccine, then you probably shouldn't get that vaccine. If you have an immune deficiency where you can't mount an immune response, then there are certain, especially the live vaccines, which you wouldn't do during that time. Or if you just had blood transfusion or blood products, then those would be the main contraindications to getting a vaccine. There's a lot of gray area, I would say, for sure, with vaccines. There's a lot of controversy around family history of having a reaction, parent having reactions, sibling having reactions, you having a reaction earlier. So a kid having a reaction when they were younger to a vaccine, also autoimmune conditions. So if you have other conditions, and that's where there's some gray area, because some people would say, and certainly a lot of doctors would say, well, your child has an autoimmune condition, therefore I'm more concerned about you getting these diseases, therefore I want you to get your vaccine. And then other people would say, well, their immune system's already having issues, so maybe those are kids that are a little more sensitive, and maybe we should go a little bit slower for them. So that's where the gray area is. And then for reasons where you would want to get a vaccine, I mean, there are very few reasons which like every kid absolutely needs to get a vaccine today. Generally, we're pretty lucky. A lot of these diseases are rare. And so there's not an imminent danger of a lot of these diseases for most kids today. Doesn't mean you shouldn't get the vaccine, but it's not like you have to get it today. I would say the biggest reasons to be very mindful, or certainly more proactive, would be if there's an outbreak in your area of something, say measles, in your kid's class or some right around you. I mean, that's certainly an instance where you may want to be more proactive. If you have hepatitis B and you have a newborn, then probably you want to very strongly consider giving your kid hepatitis B vaccine early, because they have a very high risk to get it if you have it. So these would be scenarios. It's more like right around you. Other than that, you have some time. In general, we're lucky we're not exposed to most of these diseases. So then it's more of a discussion about what's recommended, but it doesn't have to be today. It could be next week or in a few months. Generally, you'll be just fine with that.
Thank you for that. Finally, my last question. Do you have any other tips, suggestions, or recommendations? Your best piece of advice for parents out there that are on this essentially like unsure of what to do right now?
Yeah. Well, number one, I think it's totally reasonable to be confused. I think everybody's confused, including doctors. I mean, I wrote a book on vaccines and things keep changing every single day. And I feel really bad for parents. I mean, I did a post pretty recently on just talking about feeling bad for parents right now, trying to make decisions, because I think it's got to be the hardest time to make a vaccine decision ever. For parents, you have different organizations that you should be trusting saying conflicting things. And I think that's really very difficult, because ultimately you just want your kid to be healthy. And it's very reasonable to be worried about a disease. And it's also very reasonable to be worried about having a reaction from a vaccine. So that kind of puts parents who in general wouldn't be super educated on vaccines, because why would you be, to have to make a decision. And so you're like, who do you trust? So it's okay to feel a little confused. It's really important to become a little bit educated on this topic. You don't have to read every scientific paper, but I think you can read some information from different sources and start to at least understand a little bit about what's going on. And don't feel woo-woo about asking questions. Like, you have to feel okay asking questions. If you're confused, if you're worried, like, speak to your doctor. And if your doctor's not able to do that or not willing to do that, then maybe they're not the right doctor for you. But just ask questions. I think that's important. And hopefully we can continue to come together and make it a little easier for parents in the long run. And I think we'll do that by finding some middle ground and balancing risks and benefits. And there are risks to everything. There's a risk to not getting vaccinated. There's a risk to getting vaccinated. And we need to understand what those are very specifically. And I think you also need to know that there's a risk from diseases. And while we're lucky that most of the risks are pretty low, they're not zero. So just start to understand what those are.
Thank you so much. I'm going to have all of your information linked in the show notes. That way, if anybody wants to reach out, they can do so from there. I appreciate your time, especially with a topic that's, I feel like, constantly changing. So yeah, I really appreciate you letting us pick your brain.
Thank you.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.